This week, the state Senate voted to shore up the 340B drug discount program in Minnesota, and census data already shows more Minnesotans are going without health insurance. Welcome to the March 10th edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mochtig.
The legislature returned from its Easter Passover break this week and got to work moving some bills to floor votes, including a key measure on the 340B drug discount program, a bill to boost availability of the 340B drug discounts to more pharmacies in the state, passed in the Senate 42-24 with votes from both sides of the aisle. Republican Gary Doms of Redwood Falls urged support for the measure.
How far should people in greater Minnesota have to drive to see a specialist? How far should they have to drive to deliver a baby? The 340B program plays a vital role in helping our rural hospitals keep their doors open.
The bill hasn't yet gotten a full House vote, but drug makers have mounted strong opposition to the measure, including a high-profile advertising campaign. Members of the Minnesota House also started discussion of a proposal to turn Hennepin County's 0.15% ballpark tax into a 1% sales tax and commit much of the proceeds to shoring up the finances of Hennepin County Medical Center. Dr. Thomas Wyatt, chair of emergency medicine at HCMC, told the House Tax Committee that the hospital is facing irreversible losses.
We need a runway to design a more sustainable future, rather than making short-term cuts or funding Band-Aids that erode our long-term viability. Because without that runway, we are forced into a cycle of reactive decisions, closing services, shrinking capacity, and losing talent, each of which makes recovery harder.
The proposed sales tax would also give up to $24 million a year to North Memorial Health. Lawmakers, though, expressed some skepticism that a sales tax would be the solution, noting that in most of the county, that would put sales tax rates at 10%. Several lawmakers said they'd like to pursue other options, like diverting a statewide 1.56% hospital surcharge to HCMC. GOP State Representative Danny Nadeau of Rogers, who wrote skeptically of the county sales tax plan in the Star Tribune this week, told NPR News that a different option may get votes in the House.
We could look at a small increase in statewide sales tax, along with maybe a metro-wide, and then create an uncompensated care fund where all hospitals then would be able to draw down additional dollars based on Medicaid days or, encounter data. And so not only would it help HCMC, but it would also create capacity for other hospitals to see a higher percentage of our public program patients.
The debate also follows another leadership change at Hennepin Healthcare, the fifth since January, as the system has struggled with a reported $200 million annual deficit. As of today, Dr. John Cumming, a trauma surgeon and former interim administrator, will take over as interim CEO again. Also this week, providers at Regions Hospital and Gillette Children's Hospital urged parents to get their kids to wear protective gear and use caution after a surge in injuries among kids related to electric scooters, bikes, and motorcycles. The warning came in part from the mother of a 14-year-old girl who died from head injuries last year after an electric scooter crash. Danielle Michaels spoke about her daughter Stella, who died in January 2025, months after a debilitating crash.
We were careful parents. Stella was responsible. We never imagined something like this would happen to our family. But all it took was one ride without a helmet.
E-bike and scooter crashes sent 466 people to clinics and emergency rooms in Minnesota hospitals last spring and summer, according to Minnesota Hospital Association data. And there was a new look at the U.S. population without health insurance from KFF this week, including in Minnesota. Abby Mochtig has more.
The nonprofit said a variety of factors came together in 2024 to reduce the nation's insurance coverage for the first time since before the COVID pandemic. A new analysis of American Community Survey data indicated that the total number of people aged 64 or younger without health insurance grew by 1.3 million in 2024, and the uninsured population grew from 9.5% to 9.8%. The analysis included data for Minnesota, where KFF said the uninsured population overall grew by 1.5% from 2023 to 2024, although that number was nearly 2% for Minnesota adults under the age of Medicare eligibility, compared to a national uptick of just 0.3%. That means nearly 1 in 13 Minnesota adults not yet eligible for Medicare now don't have any insurance coverage. KFF called the change in Minnesota statistically significant. The rise also comes before the end of Affordable Care Act credits last year, and as the state is preparing to comply with new work and enrollment requirements for Medicaid that are expected to leave tens of thousands more without any health coverage starting in January.
Also this week, CMS issued new guidance to states implementing provisions from H.R. 1, or the One Big Beautiful Bill Act, that will limit Medicaid and CHIP funding for certain non-citizens beginning this October. Ellen Florek has more.
Under the guidance, federal matching funds for full Medicaid and CHIP benefits will be restricted to a narrower group of eligible immigrants, such as lawful permanent residents and certain other categories. Other lawfully present individuals, including refugees, asylees, parolees, and survivors of trafficking, will no longer qualify for full federally funded coverage. They may still be eligible under state-only programs. Many non-citizens were already ineligible for Medicaid, although the state of Minnesota opted to offer limited coverage to undocumented residents in 2023. The legislature rolled back Minnesota Care coverage for undocumented immigrants in January, although it kept coverage for undocumented immigrant children.
And finally, the Minnesota Department of Human Services says it's wrapping up yet another step toward winning approval from federal officials to resume some frozen Medicaid payments to the state. The Minnesota News Network said the Minnesota Department of Human Services says only about half of the state's 5,500 Medicaid-funded social service providers have completed applications to continue eligibility for payments. More than 500 have been approved, and more than 100 banned from billing Medicaid. And that's it this week from Healthline, a weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig.
Thanks for listening.